People are talking a lot about breast cancer, cervical cancer, awareness, screening. But what about ovarian cancer? Ovarian cancer, although is less common than breast cancer and cervical cancer, but unfortunately, once ovarian cancer is diagnosed, it is already on advanced stage and it is too late. Unfortunately, tiny changes on the ovaries due to cancer are very difficult to diagnose. No sonography, no MRI can detect ovarian cancer at early stage. And that's why it is important to know the history of the patient, family history of the patient, to know risk factors and appropriately diagnose and appropriately screen this patient. And that's why I want just to share with you some numbers. If you can see from this slide, 87% of cases diagnosed after 45 years old. Yeah, it can happen at any age, but maximum rate is at 55, 64, and started to grow after 45 years old, with overall incidence after 45 years old, 87%. And this slide, this video is not to scare you, but to emphasize the importance of visiting doctor and being aware of possible also changes in the ovaries. The earlier the ovarian cancer is detected, I mean the early stage, the higher the survival rate. We can see if the ovarian cancer is diagnosed when it is localized at the early stage, the survival rate is 93%. And when it is diagnosed and it is already advanced stage, the survival rate is only 28%. And also the recurrency, the earlier stage is diagnosed, the lower the recurrency, 10% only. But when the ovarian cancer is diagnosed and it is stage 4, advanced stage, the recurrence is 90%. I hope these numbers did not scare you, but encourage you to visit your doctor and on regular basis at the age of, especially after 45 years old, and especially at the age of 65 years old. And be aware about symptoms of ovarian cancer and be aware about your family history and discuss with your doctor all this issue and all your concerns.